Great. So a huge thank you to everybody for joining us today. We're very excited to have you here for our session on better public-private partnerships in health. What does it take? For those of you who I have not had the opportunity to meet yet, my name is Sarah, and I'm a technical advisor at JPIGO. I work closely on market solutions and sexual and reproductive health issues. So today we are incredibly excited to welcome each of you and are really looking forward to what we know will be a robust discussion on the key ingredients for better public-private partnerships in health. We want to give a huge thank you to our panelists as well as the many organizers who helped make today's session possible. Before we begin, we wanted to take a moment to consider the role of the private sector in health. Did you know that nearly 50% of the expenditure on health in low and middle income countries is private? That number increases further for certain countries, like we just talked about in our trivia questions, and also for certain health areas, including malaria and maternal and newborn health. The private sector plays a critical yet largely untapped role in delivering health services for maternal and newborn health, malaria prevention and treatment, family planning, and many other primary health services. And while that role is critical, the role of the private sector is largely untapped with significant room for growth. So what then is preventing better public-private partnerships for health? That is exactly what we are hoping to explore with our panelists and all of you today, not just looking at what prevents these partnerships from being effective, but also ways in which we can overcome those barriers together. So while the private sector does already play a crucial role in providing services, holding the majority of the market share for many services across the globe, access to private sector care isn't consistent. If we look across different regions or socioeconomic statuses, we see a lot of variance in the level of engagement of the private sector for quality health service delivery. Typically, the private sector care is more associated with wealthier urban communities and less accessible to lower socioeconomic groups and also in rural communities. The other thing that we see is that over time, the trends of provision of care by the private sector have largely remained stagnant with no significant increases in the usage of the private sector for primary healthcare. And so today we want to explore ways in which we can further tap into the role of the private sector to expand access to primary healthcare globally. So the COVID-19 pandemic provides an important case study in the promise of public-private partnerships for health delivery. As public resources were strained to respond to the pandemic while maintaining the provision of essential services, many private companies coordinated to help fill the gap. There's two different examples that we wanted to share that came out of the COVID-19 pandemic. The first is the West Africa Private Sector Coronavirus Platform. And this was a group where private sector groups in both Ghana and Liberia worked together to provide additional testing, procurement mechanisms, and communication campaigns associated with COVID. And so these groups were able to coordinate closely with public stakeholders to accelerate access to things like PPE, testing, and different information about COVID in order to more effectively cover the population in both Ghana and Liberia. A second really strong example of this during the COVID-19 pandemic is Merck's provision of essential services. And so Merck was able to model the effects of stopping treatment of neglected tropical diseases, which is something that happened early on in the pandemic, supported scenario planning to think about how we could mitigate long-term effects of stopping that treatment, and then coordinated closely to ensure that treatments were available when treatment was able to continue. And so this again is an example of while public resources were either being diverted or moved to the COVID-19 response, the private sector was really able to fill essential gaps in order to make sure that people were still able to access healthcare that they needed. And so when we think about the fight towards quality primary healthcare for all, there is a really critical role that the private sector can play, especially when partnering with the public sector. And so if a more coordinated, concerted effort were made to engage the private sector, these partnerships could accelerate access to care for those who don't have it, fill gaps in the provision of primary healthcare globally, and build more resilient health systems that are better positioned for a response to any future pandemics or strains on health systems. And so as we look forward to the session today, there's a couple of different things that we're hoping that we will all get out of this. The first is to give us an opportunity to discuss some of the barriers and enablers to private sector participation in health. The second is to share some of the current evidence on private sector contribution to health service delivery. And the third is to highlight opportunities for engagement and discuss priorities for enhancing public-private partnership. And so we know that the panel discussion and presentations that follow will be a very robust conversation and snapshot at some of these opportunities. And with that, I will hand it over to Tayo, who's going to help us facilitate the panel. Over to you, Tayo.
Hi, everybody. Welcome. And it's a real pleasure to be part of this session today. My name is Timothy Rubu. I'm the Director for Multilateral Engagement and lead for the MSD from Others initiative for advocacy. Yeah, this is very much at the center of what we, MSD from Others, has been trying to advance for many years. And we really believe by leveraging the capacity of private sector, we can really transform how care is received by many on the continent of Africa and beyond, because as just been explained, the capacity of the private sector in these settings are massive, and the opportunity therefore is great. It gives me a great pleasure to introduce our panel, and we all agree that we're going to keep this fairly informal, but also welcome as we go on your contributions in the chat. So if you have any questions, please feel free as we advance to ask our panelists any questions you want. So we have the distinguished panel, as you can see, Radha, Grace, Frank, and Kennedy. You can see that where they're from. It's a real great diverse group. The first question, to just dive straight in, will be the first question really for all the panelists really to tell us how their work is really helping to it fits into this discussion today, and give us some concrete examples about how their work is contributing to this space. So perhaps.
Thank you so much, Tayo. Thank you, Japrigo and WHO, everybody, for having me on. I'm really excited to be here. My name is Radha Karnad. I'm the Chief Medical Officer at HealthX Africa, which is a virtual medical provider of primary healthcare services. And so I'm here and very excited about this because I think public-private partnerships or partnerships with the government are absolutely central to what service providers like ourselves are trying to do. You know, our vision at HealthX is a doctor for every Kenyan, and we realize that there's absolutely no way we're going to achieve that without partnership with the government, and nor should we. The right thing to do is to reach this access through partnership with the government. So I am excited to be part of this discussion, very much with the focus as someone on the service delivery side, someone currently learning and navigating what these types of partnerships look like. So I wouldn't in no way say I'm an expert, but I am living this right now as we speak and learning as we go about these types of partnerships for impact and for scale in primary healthcare. So thanks for having me here.
Great. Grace, can you tell us how your current work relates to our discussion today?
Yes, so my name is Grace Chionuka. I'm the Executive Director of Uganda Healthcare Federation. We're an umbrella body for the private health sector in Uganda. And apart from bringing together private sector players of all types, shapes, sizes, so we're a membership organization that brings together human resources in health, pharmaceutical manufacturers, in other industries in manufacturing and health, and ICT in health and so forth. And really our role as the Federation is to really translate for local, regional, and international partners the realities of the private sector. We really try and highlight and showcase the pain points and the challenges from a private sector perspective. And we really try and show the other side of the coin to both government and health development partners and other stakeholders, and really push for participation and inclusion of the private sector to be more equitable, both the PNFP and the PFP on a regional, national, and international level, so that we make sure that everybody who's in the room is included in the discussion. And while you're in the discussion, that your voice is heard. Yes, so we're really trying to make sure that we push for data capture, capacity building, and linking the private sector to each other, to learn from each other and to be better understood.
Thank you very much. Then over to Frank. Frank, can you tell us a bit more about what you do and how you contribute to this current discussion today?
Thank you, Tayo, and thank you, everyone, Japrigo, and the audience. Thank you for making time to join us in what I think is a really important conversation. So I'm Frank Aswani. I'm CEO of AVPA. I'm Kenyan living in Johannesburg. We are a network of social investors collaborating to increase the flow of capital into African social investments. I think one of the biggest contributions we're trying to bring to this space is on a couple of fronts. The first front is to discuss the problem we're trying to solve. And largely is that of how do we finance our social investment needs on the continent. At a macro level, if you look at the SDGs and the respective healthcare SDGs, is how do we get to close that gap? Because in totality, the continent needs between $500 billion to $1.2 trillion annually between now and 2030 to meet its SDG financing gap. Now, this was pre-COVID. If you look at the latest numbers, it said that COVID added another $1.7 trillion to the global financing gap. So just think about the magnified impact that COVID has had to us. And traditionally, if you look at, especially a sector like healthcare, which is seen as a public good and a public service, this has been heavily funded by aid and government funding. But we've seen what has happened to aid in the last couple of years. Aid has reduced dramatically, especially when Trump, in his USAID days, cut back aid funding. The UK government did the same. And even as we look at the aid coming to Africa today, it's not coming in the traditional pots it used to come in. It's coming in as impact. It's coming in, aid is replacing, trade is replacing aid. And so it leaves us in a very difficult situation. How are we going to fund our healthcare, and how are we going to fund some of these financing gaps that we've got? And the natural place to look into is the private sector, because if you look at capital markets, they have about $250 trillion. Financial markets, maybe another $300 trillion. We just need 1.2 of that every year. But traditionally, the private sector, when it looks at the development space, doesn't understand the space well. They think our projects are too complicated. They are too risky. And so what AVPA is trying to do is trying to see how we can increase collaboration between the traditional private and philanthropic sector and private sector, public sector and private sector. And this middle ground, we believe, is where we'll find the sustainable solution. So it's about how do we bring the different competence, different capital to de-risk social investments. How do we create innovative finance tools like social impact bonds, outcome-based financing to crowd in private capital in this space? And how do we change the mindset, for example, that there isn't a conflict between profit and purpose? We can still do well as we do good in this space. So all these things are the things that AVPA is trying to do. We are an investor-only community, so we're doing it at a very ecosystem level. So super excited to be here today.
Great, thank you very much for that. And last but not least, going home, Kennedy to Nigeria.
Yeah, thank you very much, everyone. I'm Dr. Kennedy Kechukwu-Abiao. I'm the National Quality of Care Focal Person for the Department of Family Health, Federal Ministry of Health. So greetings to WHO and JPIGO for ensuring the Federal Ministry of Health is here to also share lessons and participate in this wonderful discussion. So for quality of care program, it's been implemented in Nigeria using the WHO conceptual framework. And this framework is cross-sectorial and is an innovative multi-stakeholder partnership, which is aimed at reducing the maternal and neonatal mortality in network countries and also improve the client satisfaction. So maternal and neonatal indices have remained low for about 2 decades in Nigeria. And one of the major causes, major contributory factors is poor quality of care. So we see that quality of care coordination platform, the technical working group, with support from partners, WHO, conducted an exploratory study to determine the mechanism of engaging private sector for demonstrating, delivering, and accountability of quality care for maternal and newborn. So one of the findings we'll see that public sector constitutes about 38% in Nigeria, and they provide about 60% of these healthcare services. Though with the high population, polyglot nation, high population, reduced economic, we see that trying to achieve universal health coverage and maternal and newborn as the entry point for foundation for trying to build sustainable healthcare environment is why we're looking at how we can engage the private sector. And this is a very, very welcome development because in all the SDG goals, we have to re-emphasize the need for partnership, if it's financing, if it's capacity building, whatever thematic area you want to identify. So we Home Back Care, we're looking at how we want to engage the private sector to provide this care and also even distribution around the geographic regions in Nigeria. So this is a welcome development. And some key other findings we are seeing is that private sector are providing quality care, but at high cost, and also there's high out-of-pocket payments. So mainstreaming private sector coordination within the public is very, very important, and how we want to try to build on existing structures to foster good environment is how we are here to learn and also share our lessons. Thank you very much.
Thank you so much, Kennedy. So I think there's a consensus from everybody in terms of the value of the private sector has to play in terms of strengthening our responses to care. But I want to dive in a bit more deeply into what actually make these partnerships, these engagements actually work. And Grace, perhaps if I come to you, given that you have this cross-cutting responsibility in terms of bringing private and public sector together, engaging with different stakeholders to make sure this works. Can you tell us a bit more about the, those special ingredients, or what are the fundamentals that we need to do to make this actually happen?
I think from the outset, we need to make sure there's a legal or even a policy framework that allows the public and the private sector to talk to each other. I think if you look at countries like Uganda, we've made sure that there's a PPP desk within the Ministry of Health. And there's been a big push to make sure there's private sector specific desks in each sectoral ministry. The challenge then comes in to make sure that these are actually operational and they actually understand the private sector. It's well and good having the desk there, but does it really understand what the value proposition is of the private sector? Then there's also the issue of, now that we have the policy, do we have the correct perception or the political will or even the policy will of including the private sector? So it's not just a symbolic gesture of having that desk there. To make sure that you don't just have them in the room, that you understand what does the private sector do? What are its challenges? What are its characteristics? What are the ways in which we can plug the private and the public sector together so that they truly complement each other and they're not perceived to be competing with each other? Because I think a lot of times there's a perception, especially from government, that the private sector is trying to outshine government and make government entities look like they're not functional or they're not efficient, which is not necessarily the case. However, it's also really how we frame our discussions with government, that it's not necessarily to say, this is what you're not doing. It's more to say, this is how we can do it better if we work together. So as the private sector in Uganda, what we've been doing as the Federation is making sure that we weave our interaction with the government to be more supportive, that we co-chair and co-support and collaborate more in terms of policy discussions, in terms of programming. Recently, we've been working on data capture, and we've been working with the Division of Health Informatics to come up with a mechanism whereby private facilities data is fed directly into DHIS2 to circumvent the challenges around HMI's tool printing and dissemination around private facilities. That is an actionable tool that shows the government that we are willing to be compliant to the national policy framework. But we just needed a vehicle in which to do that and a mechanism to actualize that. So if you have many of these small pieces and you fit them together well, you're able to have a more impactful engagement between public and private sector, rather than just having it on paper that, yes, we do work with the private sector.
Thank you very much for that, and really rich response. I could go on forever in terms of asking, but I want to bring others in. I saw Ryla nodding frantically to some of those comments that you were making. Ryla, do you want to contribute to that in terms of your own experience around that?
Yeah, thank you. I felt like Grace was reading my mind while she was talking. So, my feeling on this, or the way I've been thinking about it in sort of, planning for this, is I think there are sort of three capacities or three needs, both internal and external, to private sector that exist for these partnerships. On the internal side, data, like an understanding of the health market through really good data, I think is invaluable. It helps to understand the real challenges. I think otherwise time and resources are frequently misspent because there's a misalignment between what the private sector sees, the data from the public sector, and the needs in the actual health market. And without a willingness to openly interrogate that data, I think there's an opportunity that you get the wrong types of players, or not quite the perfect set of partners in a relationship, and you can end up solving for a different problem than something that's actually the root cause. And I think that frequently, we've seen that frequently happen in public-private partnerships that haven't quite worked out the right way for health. I think another need, internal need for the private sector in these types of partnerships is really strong design skills. These relationships, and Grace alluded to this, they're very complex when it comes to the partnership. They're multifaceted, they're expensive, and there may be this, lack of alignment or a difference in ethical and process-related decisions that have to be made from the private sector side and from the government side or the public sector side. And so you need the right people, not just technical people, but financial, legal, environmental, like there's a range of different skill sets that are needed to properly structure and execute these types of partnerships. And I think the third internal need really for private sector is advocates and champions, those right networks. I remember sort of when I was setting off in this, somebody saying PPPs don't work without champions, government partnerships with governments don't work without champions. And I think that has stuck with me always, because the right champions, they play a really critical role in advocating for the appropriate integration of private sector approaches into the public system and the value that private sector bring to these types of relationships. So I think those are really critical, and what I think of as sort of internal capacities that are needed. And externally, I think Grace spoke to this, and she's absolutely right. A regulatory and legal framework unquestionably is absolutely critical. We see that right now. I said I work in virtual medical services, and around the globe with COVID, we see an expansion of digital health, telemedicine, virtual service delivery. Yet many countries, the regulations don't allow things such as e-prescribing. And so at the end of the day, the regulatory framework really diminishes the effectiveness of telemedicine services, because patients are still required to go physically to a doctor, sit with them, and get a prescription. So I think when the regulatory framework doesn't support the actual involvement in the right way, or doesn't really support private sector models of operation, then that can become a huge challenge or liability. I think here the government has a very important role in aligning motivations, again, speaking to something that Frank said, because there's a private sector drive for profit and a public good, and those don't necessarily always come together, but the government can act as an integrator of alignment between the patient, the payer, and the provider. Finally, just very quickly, I think the sixth need or external need really is around commitment and stability. PPPs are inherently unequal. The government works, with certain aims and goals, and through their term of office. Private sector may be looking for a longer term sort of established relationship. And the private sector needs some commitments to maintain the stability of that contract, to make sure that, over the course of a government's relationship with the private sector, be not necessarily the individual people, but the overall government and the private sector, that those commitments, that stability of their relationship stands. And as Kenya goes into our elections this year, that's a real fear for many of us on the private sector side as to what this means for existing structures, existing PPPs. And so we're seeing that in action, or that fear is arising in action this year. And it remains to be seen, what that looks like going out. But commitments towards alignment of relationships, stability of these contracts is really very important.
Thank you very much, Radha, and another very comprehensive response. I want to pivot to Frank before I go to Kennedy. Frank, you've heard, from the two responses we just had now, some of the things that jump out to me is around the policy framework and around data. Relating to financing, how does this actually fit in? Because I fundamentally think those are kind of important in terms of being able to actually get investors to come in and think about the ecosystem as an opportunity to invest and to help advance healthcare. How do those fit in, and are there any other things from what you've heard from Grace and Radha?
Yeah, I think Grace and Radha raised some really good points. And from a financing perspective, we've got to first of all recognize that the old solutions are not going to solve our new problems. The world of tomorrow demands a very different approach to how we mobilize and deploy resources, of which capital is one of them, and non-financial resources as well. So I think this time calls for a very different paradigm where we each accept that on our own we can't solve the problems that are in front of us. Secondly, it's important to bring our different strengths to each other. And thirdly, we should fall in love with the problem, not the solutions, because sometimes we fall too much in love with the solution that we forget that we have a mutual problem to solve. So on that end, and especially from a financing perspective, as I mentioned to you, we almost have very little choice to where we can get money. We don't tap into the private sector. This demands a really new approach. So I think the private sector has some really pivotal points and role to play. One of the biggest things, for example, I'm talking to private philanthropists around at the moment, is they have a really crucial role at the moment to test, because they can, the kind of money that they carry, the grant money that they carry, can take a lot more risk. And I think they have a really crucial role to play in testing new products, new markets, new services. They can fund a lot of our early stage social enterprises that are trying out new models. I mean, we tried to pull together SMEs, social enterprises during the COVID crisis to see which of these were doing some cool stuff that we could get some quick capital into to expand and scale their impact. And we struggled. First of all, you can't find them listed anywhere. It's not easy. Secondly, they're just not in a format where you can track the impact to date. And that's where private, like philanthropy, can come in, is to really support some of these creative and high potentials for scale social enterprises to really get to the proof of concept stage. And in the process, then we're not only supporting this business to grow, because Africa is a capital for impact. We are the global sandbox for impact. There's no better place for impact players to play than in Africa. Our problems are phenomenal opportunities for impact. You know, we should be very, this is where I grew up thinking that it's very bad to be in Africa. Today, as an impact player, it's fantastic to be in Africa. There's no better place you can demonstrate your skills and competence than in Africa. So I think private sector, from a finance perspective, do some of the early stage, high risk stuff, so that you're taking these models to the government that have been shown to be effective. All they need is additional capital for growth. Now, that's where the policy space also needs to change, is how do we enable finance to easily flow into these businesses at the point of growth and scale, something which I think Grace touched on that we need to look into. I think the other thing we need to think about is the public and private sector need to see themselves as a part of a continuum. I think one of the biggest suppliers of finance is, and especially grant and high risk capital, is government. If we can use government funding differently, once again, either risk capital or to do things like supporting them, innovative things like outcome-based financing, where we can almost guarantee better outcomes for every cent we spend. This is the time for us to test new models of delivery. We can't be stuck in the old models where tenders are taking 24 months before they're rolled out and finalized. So there's a lot of stuff that we need to think about. And then for me, I think finally, when I think about some of the stuff that the governments do on the financing side, if our governments can support some of the regulations to be more effective, I think we'll see more commitment than compliance from the private sector. Currently, I feel in some cases we see more compliance than commitment, because the private sector wants to please the government. In many cases, they put in some money in government projects here and there, but they don't commit some of the big money that they have in their balance sheets to these projects. I think we could do a lot more in this space to crowd in private capital in this space. So I think it's super exciting, but from where we come from, and finally from where we come from, there's a lot of unconscious incompetence from both the public and the private sector in this new innovative space. So what we do, like AVPA, is to try and run training programs to teach this new space, the players, new social investors around, what does it mean to play in this innovative financing space? And sadly, Tai, I'm not sure whether you knew this, but the whole continent of Africa has only one institution of learning with an innovative financing program. If you want to learn anything around innovative financing in Africa, University of Cape Town is your only choice. The others, you've got to go to Oxford or Cambridge, and you know what will happen? No offense to anyone from Oxford or Cambridge here, they'll charge you an arm and a leg for 20 people before you come back. So that capacity also at institution level is what we're doing at AVPA to try and build.
Thank you very much for that. So Kennedy, as the government representative here, I'm going to put you in the hot seat. Sorry, because it's a civil, I'm sort of like putting my brother as a fellow Nigerian on the spot, but as a government representative, what is government like Nigeria, for example, doing around some of those elements that you heard from our speakers in terms of strengthening data systems between public and private sector, or in improving the policy environment so that we can, all work more closely together? If we just think about some of those, and also from a finance point of view, if you have any contributions to make related to that.
Yeah, thank you very much, Temi. And just to build for some points from Frank, It's a new space, and it's an innovative space. So a lot of competition, a lot of concept of how to implement private sector, public-private partnership. But first of all, just to say a partnership, it's just a mutual or formal agreement between two entities just to share profits. So coming to say, how do you want to share profit from the private sector perspective? The government should provide the enabling environment. From Nigeria perspective, it's a mix, and it's supposed to be a balance. And so let's start with how do we try to ensure or strengthen this public-private platform communication. First of all, is to have the commitment from the high-level political space. So for anything to thrive in Nigeria, you need to have the political buy-in, the administrative buy-in, or the head of the highest level buy-in. Because of the way the constitution is run, because of the way the healthcare system is run, we have the federal and state and local government implementation levels. So we need the highest political level of commitment. The government is buying into this innovative mechanisms to bring in the private sector and public sector. One way the Nigeria has also demonstrated to engage public sector private partnership is the Executive Order 007, which the President Muhammadu Buhari has issued in 2019. We talk about road infrastructure and reimbursement of tax credit scheme. So this is one approach the government is using to try to see how they can finance road infrastructure, because in itself, it cannot also try to ensure that with its budget allocation, yearly allocation, meets the demand for infrastructure. So we already have some weak healthcare systems already. So these are systems which with the daily process, day-to-day routine, which we need to strengthen. And one of the ways the study was conducted was administrative policy and administration, service delivery and regulation. So these roles are very, very key for how to enact and strengthen private sector public partnership. So first of all, for service delivery, there are a lot of players in the game who also want to provide services. And so some of them are caught up with the insurance scheme. Some of them have low capitations. So a lot of problems with that. How do you want to strengthen public service partnership? First of all, the government needs to reposition itself, try to ensure that there is seamless, predictable default system that we can say, today, this is how it's supposed to go, this is how it's supposed to. So we need to predict our financial system, we need to predict the governance system. And this is one of the ways we need to strengthen that engagement so that we can also provide some kind of oversight functions to the private sector. So if we don't put these foundations down from the public sector, it will be also very difficult to also try to checkmate the private sector. So one of the things apart from political commitment, which is going to be the driving seat and the platform, which we can build these innovative mechanisms, we also need to ensure that there is good systems in place. So for data management and other pillars, so the quality of care framework, which is what we're leveraging on and trying to use as the entry point to see how we can say public-private partnership, is built on the health system pillars, the 6 pillars: human resource, health information system, service delivery, leadership, access to medicine, yes. So that point. So for DHIS2 systems and health information system, the quality of care last year we developed the National Reproductive, Maternal, Newborn, Child, Adolescent, Elderly Monitoring, Evaluation, Accountability and Learning Plan. So this is just a plan to try to ensure that the public sector in itself is already measuring key and global indicators in line with the Quality, Equity, Dignity Network, which Nigeria is part of the network countries. And we also signed that commitment. So that is also a way to try to say, how can we provide accountability in incorporating the civil society's regulatory mechanisms? How can also learn and share information, peer-to-peer learning from states? And what is happening is your approach of private sector partnership working? Is this state working? So a lot of ways, and also a lot of providers, health providers, have challenges with credit facilities. And to improve health financing, we need to also have regulatory or good policies or access to credit loans, which is with low interest rates, because of, we also know the problem with economic situation. So these are also challenges that they face already. Deploying digital solutions for regulatory mechanisms are also a very innovative way. So bringing all this to play, how do we want to, what the government needs for this platform is to build trust, face-to-face interaction, have a platform where all this can be discussed, where we meet regularly, quarterly, biannual, monthly, to discuss all this, because it's all about profits. So the private sector cannot have to engage with you if they are not going to see profit. So we need to build this on existing mechanisms, build your understanding, align structure, and foster good behaviors. So these are just some of the points we say. Thank you very much.
Thank you very much for those contributions. That's a wonderful segue to introduce Anna to this discussion to talk about the governance and country connector. But panelists, still hold on. We have some more questions for you, but I'll pivot to Anna first.
Thank you so much, Tayo, and thank you so much to all the panelists. What just Kennedy said perfectly fit on the presentation I'm going to give in 2 minutes, and then we'll come back to the panelists. So to introduce myself, I'm Anna Kokotz, and I'm a technical officer working in the Health System Governance and Financing Department at WHO Geneva. And next slide, please. I'm here today to present you the work that WHO has done to support countries in engaging with the private sector in the past 2 years. So in 2020, we published a strategy report on engaging the private health service delivery sector through governance in mixed health systems. And the strategy has been developed thanks to the work of the WHO Advisory Group on the governance of the private sector for universal health coverage. And it really aims at helping countries to build a well-governed health system to align and, as Kennedy said, build understanding, foster the relations of the public and private actors to collectively deliver on public health goals. And the strategy also identified the need to align global, regional, and local partners working in this area and build governance capacity, as we heard from the panelists, is badly needed at the country level to make and implement public policy about the role of the private sector. Next slide, please. So within the strategy, the advisory group formulated 6 governance behavior to empower countries working with the private sector and achieve universal health coverage through an inclusive governance of the public and the private health sector together. And as you can see from this puzzle, what can align the 2 sectors are 6 key governance behavior that in the next slide I will talk on. Next slide, please. And these 6 governance behavior that has been anticipated by Kennedy are the one that WHO sees as pivotal to really build an inclusive health system governance. And they are namely deliver strategy, which is the need for governments to establish the priorities, principles, and values of the health system, and also work towards implementing these priorities. Then we have build understanding. We talk about data in the panel before, and seriously governments need to facilitate an information gathering and sharing about all elements of service provision in the health systems. And then we have enabled stakeholders because all the actors, both public and private, should be incentivized and authorized to align their activities and leverage their capacities and resources to achieve national health goals together. As a 4th governance behavior, the WHO recommend to align structures. So to have governments take the necessary actions to align public and private structures, processes, and institutional architectures to achieve universal health coverage. As another governance behavior mentioned by Kennedy before was a foster relation, because exactly we talk even with Grace about the need for having all the stakeholders on the desk and in the policy decision making. So governments are called to establish mechanisms that allow all the relevant stakeholders to participate in policy making and planning. And finally, nurture trust, because we need accountability and transparency processes and mechanism to monitor what both private and public sectors are doing. So that's all I saw in the chat before, talking about interests and priorities that can be aligned. Yes, they can, and we call for both the public and the private sector to work together. But we need also monitoring and evaluation mechanisms for the two actors to coordinate and collaborate, maximizing the government's work in achieving universal health coverage. So that was just a quick presentation of WHO work on the governance behaviors for alignment of public and private sector to achieve universal health coverage. And together with Tayo, I would like now to go back to the panelists and to collect questions also from the floor on the topic, and both on what we discussed and what I presented as WHO work, to understand what's the impression, what's the expertise and the experience of people here today on this topic. Thank you.
And just a quick check, Chantal, how long have we got for questions? Just a time check.
So Theo and Anna, I think that you could have about 12 minutes, if that's okay with you.
Okay, cool. Great. Thank you very much for that. So panelists, we've got 12 minutes, which is very long. So I would suggest rapid responses to questions. Again, just to kick off, I think the issue around data seems to be raising its head. And how do we solve for that? I think is the key question in terms of bringing public and private sector data together, or in terms of actually sort of like understanding how well we're doing in terms of responses to care, whatever platform type of engagement we're on, we still need information, data to enable this. So perhaps we go to Grace again, given that basically Uganda has done quite a lot of work around this and trying to think about how to achieve this. Are there any lessons for us? I mean, how long has it taken you on this journey? Any nuggets of wisdom?
Yeah, I don't know if they're wisdom, but maybe what I'll say is that in Uganda, we have a big challenge. I think in the chat, you'll see Madhu is talking about sustainable incentives. And we realized that this wasn't sustainable because it needed money, it needed human resources, just to make sure that any support towards incentivizing was always a challenge, because we have 6,000 facilities in Uganda and half of those are privately owned. So how do you support almost 3,000 facilities to be reporting data? And that's why you find just under 40% of facilities are actually reporting data into the DHIS2 system. So what we've done is try to look at it from the other perspective. How do we make this data meaningful to the facility so that it's not perceived to be government's data? Because when you speak to facilities, because they get the tools from the few that get them from the HMIS tools, they say, but it's government's data. We've submitted to government because it's a requirement to report data to be licensed and to have your license renewed. So that in itself has that disassociation on the value that that data actually offers. And so that's why we pushed on its head and we've said, how could we make this data meaningful at facility level? So what we're piloting now is to see if we can put some analytics so that as the facility assesses itself for quality, there's also a business and finance component towards that quality improvement self-assessment that automatically generates a profile of that facility and what its systems inside the facility looks like. Once we get past that level, then we've also enabled them to access a platform that will allow them to capture the data straight from the facility, the basic day-to-day patient register data that they capture anyway, and have that reported directly into DHIS2. And when you do that, because yes, first of all, you're complying with the regulatory framework, but at the same time, you're able to get this system to come out with some basic analytics that are informative to the facility when it comes to how they're performing at a facility level. How many deliveries are you having? How many ANC visits do you have? That way you then get to the decision, do I need to buy a new delivery bed? Or should I invest in an X-ray? Or should I invest in an ultrasound? So that in itself is allowing the leadership and the management of the facility to look at that data very differently, so that it's no longer just government's data to see how many people did I see, but at a facility level, how does that translate into my investment decision, into my growth decisions? You find a lot of facilities thinking, well, the facility next door has an ultrasound. I need to get one too, so let's stop referring patients to go there. But now if you give that facility an ability to access data and an analytics around what the patients they're seeing are doing, then you get into a cross-pollination discussion. And that's why UHF, where I work, we have these monthly platform meetings where we allow facilities to talk to each other to say, this is what I'm seeing, what is your experience? And that ideas sharing, peer-to-peer discussion brings out a discussion around collaboration, around partnership, private to private partnership, because at the end of the day, they don't have access to affordable financing to buy all this equipment that they'd like to buy. But if they're able to invest a little more wisely in terms of leveraging the resources they have to be able to improve the scale and scope of services they're giving at community level, then we're able to have more impact, especially when it comes to maternal and child health, which is one of the pain points we have as a health system. Over.
Thank you very much for that response, and I knew it was a good idea to go to. So is there any other question you want to field to the panelists? If there isn't, I was going to jump to Frank again to talk about data, and given what you just heard from Grace, how do we actually leverage that kind of information from a financing point of view to be able to actually, seek more funding and support for expansion of services and investments in services?
Yeah, Grace raises some really good points. In my previous life, I ran an organization in South Africa that had 800 employees, and over 30% of South Africans going onto ARVs came through our clinics, and we had site level staff members, and people always assume that government employees have no incentive and pride in their work, that they want to see good data coming out of the sites, but actually many do. Very many take pride in the work and the quality of stuff that they're able to deliver. And I think sometimes, this data piece is a sticking point that continues to haunt us for a long time. But there's various ways in which I think we can use the data creatively. The private sector wants this same data for marketing. There are a lot of people who actually just want this data just for marketing, for selling information, because they're paid on the number of hits they get on social media because times have changed as well. And I think this data can be used creatively to engage the private sector. It's not necessarily the person who is involved in healthcare provision directly. It could be someone who's involved in health information who requires that data. And that data can be used creatively to engage different types of players within the value chain of healthcare. And the process, investments can be brought back into the healthcare space. But I think it once again, it needs a different type of mindset. There's a different type of manager who views and approaches the solving of the problem very differently. And that may not necessarily be the kind of manager who's been there 20 years, for example, who's only known one way of delivering value and utilizing what he's got, to whom data is probably very new in many ways. So I think there's a bit of paradigm shift that we need to drive through this process. But I can tell you, if I look at some of my investors, they're craving for data. They're really, because it helps them make smart decisions, and they can't find the data very easily.
Yeah, thank you very much for that. Radha, do you want to comment on that as well? I see some comments related to Kenya in the chat. The private sector data sharing is not necessarily mandated, and institutions aren't necessarily incentivized to do this. What's your experience around the subject?
Yeah, thank you so much. I think, it's really exciting to hear what Grace had to say around Uganda. And I think Kenya Health Federation is working on something similar, probably inspired by Uganda here. And that's been a huge, huge shift for us, and that we've just been recently hearing about. But, the honest truth, and I have made the move from an NGO sector to private sector. This is my first time here, and it's very, very interesting learning for me to see just how little the private sector is sort of incentivized, and I don't mean financially, to report our data. It really feels like an optional thing. it's nice if you do it. If you don't, okay. And that's such a shame, because I think, there's a misalignment, and this is across the private and public sector, this sense of like data is the government's. When we ask for data, when we were trying to build our model, we were told by government officials, like, it's not your business. You just figure out what you want to solve and you do it. Like that, a lot of pretty relevant data is not easily accessible to the private sector, because it's considered that you're trying to work out some sort of competitive advantage, or you're trying to take advantage of the system more broadly, which is really a shame. And I think on the flip side, the private sector, there's sometimes this feeling, exactly as Grace said, that this data is going to go into some nebulous gray space and doesn't benefit us in any way. And what we need to come to, and all of us see in our day-to-day lives the benefit of data. We are working every day in the private sector using data to refine our efficiencies, refine our models, make sure we're as cost effective as possible, make sure we're reaching the right model. So if that works within our little ecosystem, I think we have to understand and realize that that's going to work in a much bigger way for impact, if we were to come together. So I think that we need platforms, we need intermediaries, maybe like the health federations, etc., to bring the right people to the discussion and make sure that people are seeing that that there's alignment. Government are the best place to do that, but that's not always happening, unfortunately. But if we can align everyone's needs and everyone's expectations around how data is used, and data is sometimes monetized in a way does not make it a public good. So there is that side of it. There is the right, people are fearful for the right reasons. And I think, again, that's where the regulatory framework, going back to earlier points, like the regulatory framework helps to address that if there's the right regulatory framework in place. So there's multiple different sort of internal and external struggles right now that we're all facing in trying to figure this out. A lot of this is new space for us, as a country, I think, or as a region. Yeah.
No, thank you very much for your response, Radha. Good to get someone that actually that's trying to solve this, and also your experience from the civil society perspective as well. I think it's really great to be able to actually merge the two and understand the lived experience of trying to work in the space. Kennedy, we should come to you next and last, but not by no means least. Around the very same question around data, and if you could be quick, please, because I think we're running out of time. Just how, again, a point on how the government of Nigeria is trying to bring together this public and private sector data, and how it's, particularly if there's any work around trying to make sure that private sector understand the value to them beyond you need to comply with regulations.
Yeah, thank you again, Temi. And for public sector, first of all, we'll have to just strengthen public sector data. Data, the new oil, is very, very important. And especially one of the governance behavior, building understanding, information gathering, information sharing. So we have developed the MIL plan, the Monitoring, Evaluation, Accountability Learning Plan, which will help us to promote and establish learning platforms, tracking indicators, the global indicators. This is one approach. We also see strengthening data capturing systems within the public sector. But for private partnership, public-private partnership, establishment of health information exchange is very, very important, because this implementation of this partnership will be implemented at 3 levels of care: primary, secondary, and tertiary. So, and also it will be very important that the government promotes and regularly updates sharing of this information, and to convert it for use and to direct specific interventions. If this is being seen by the private sector, at least it will promote them to also want to try to engage in trying to capture this data and link with the already system that already existing. Because a lot of private sector might be scared because of punitive measures, tax payments, and why are you getting a lot of data, clients overcrowding, overload. So this can also discourage the private sector from getting data. So establishing learning hubs from different states also help us promote this data sharing. And also leveraging on all platforms, collection of data, leveraging on the DHIS tool is one of the ways that the Federal Ministry of Health, through a memo from the minister and a statement from the minister, has also said before 1st of December, all health institutions in Nigeria should be gathering and collecting information on the DHIS too. So this is very, very important, and it's a way forward for us to see how we can harmonize data collection, data gathering. So we can now link it with Health Information Exchange, HIE, to the private sector, and this will bring better collaboration. So also to resuscitize the population and also key stakeholders, that data use is very important. What do you want to use your data for? To direct intervention, specific requests, acts. So these are why we want to use it. So just to round up, the quality of care framework is actually built on monitoring, and research. So we need this data to inform us on whether we are progressing, whether what we are doing is at work or is has not worked. So that's why we see we are also paid a focus of how we want to establish data. Recently, we just held a very onboarding meeting with the Health Management Information System at the M&E subcommittee meeting to say how we can collaborate together to bring and foster data sharing from the states, because this is where the implementation is happening. Thank you.
Thanks so much for that. I just want to thank all our distinguished panelists. It's been great engaging with you all, and also hearing from the audience as well, the questions in the chat, and my colleague also, Anna, for her contribution. So thank you very much, everybody. I need to pass it over to Chantel or someone else from the team for the letter for the next session. Thanks, everybody.
Thank you very much, Tayo, and thank you to the panelists. It was quite interesting to hear the experiences, the point of views, but also to hear that there is so much convergence and willingness in working together to improve the health of everyone. And in my case, I look at the health of women, children, and adolescents. My name is Berta Malici. I work for the World Health Organization in Geneva, and I work exactly for the Department of Maternal, Newborn, Child, Adolescent Health and Aging. I lead the team on program strategies and policies, and in the last few years, I've spent a lot of time on quality of care, as well as on private sector engagement for delivering quality maternal, newborn, child health. So I'll take a few minutes now just to go through a set of slides and a bit of information around what we have discovered through the different investigative or research methods around the engagement of private sector to deliver quality maternal, newborn, child health services. This is a question that does concern all of us. The mothers and children are the biggest users of health services, the biggest users of health services in both public and private sector. In many countries, the attention on improving quality of care in general for the health systems has been in the public sector. Countries that we are engaged in working with, they have highlighted that they would like to see the health system as a whole, so the full mixed market, public and private. Hence, the question that has come to WHO has been what is it that we can do better, differently, what we know from the literature. Next slide, please. So as we went forward, we did articulate three main areas. We saw what is that already exists, what the research tells us. At the same time, we wanted to engage directly to understand what countries say. And we had the privilege to engage with Nigeria, and Dr. Kennedy is already a panelist today in this session, but also Ghana and Bangladesh. And I would share a few very highlights from that process of the country implementation and policy dialogue, and then introduce what is coming next. Next slide, please. So first of all, what did we learn from the literature? Next slide, please. We did ask 2 years ago 4 primary questions, research questions. We wanted to understand how does the provision of quality healthcare by the private sector affects morbidity and mortality for mothers and newborns, how the provision of quality healthcare by the private sector affects utilization of services. Is there a change in that utilization for mothers and children? How effective and efficient is the private sector at delivering quality of care? And what are the experiences of care of mothers and children in the private sector? And as an underpinning or as a bonus question, we wanted to understand a bit better what are the mechanisms that already exist for this engagement, and if possible, to understand their efficiency. Next slide, please. So quality of care in literature and in science, but also in practice, and I think there are practitioners in the group today, is defined as effective, safe, timely, person-centered, efficient, and care that provides, always provided with equity. Those are the 6 core dimensions of quality of care. So in our literature, we looked over 20,000 references. We squeezed down into 800 plus, and then we identified 110 studies, which included the review of quality or at least 1 to 3 elements of the quality definition. What we found that it was interesting, it was that only less of a third of the studies did define and measure and report it on quality of care. So while there are studies that are looking at public and private service delivery, they do use the word quality, but when it comes in terms of defining exactly what the studies are looking at, they are not very precise. So it's difficult to draw conclusions. Next slide, please. So one dimension that was a bit clearer in terms of what studies were trying to document and share were the aspects of experience of care. For the experience of care, is a very important aspect of quality of care. It's not only provision, but it's experience. We did find that the studies that were reported in the literature, they do indicate that private sector provides a good experience care. The problem is that the respondents do respond and say that yes, experience of care is good because there is better interpersonal relationship. They don't have to wait on lines, so the care is timely. There is privacy and confidentiality. And the most comments are, they do say that the care that they have received is affordable. However, when it comes at the end, so when we start to compare, we can see that experience of care is a very subjective process and indicators of quality in which satisfaction is an outcome indicator. It is very relative to personal expectation. And it is a person's and individual expectation linked to their own processes and ways of accessing and using the services. Hence, although we do have a good indication that it seems the private sector does have good quality care in terms of experience, our results cannot be really compared with overall experience in receiving care across all sectors. Next slide, please. As we were going and drilling further in the literature, we did find that it was important to start looking at the different mechanisms. As we heard from all the panelists, everyone is referring to individual experiences, the ways of working, some of the challenges. So all those issues in a general way, at least for us, as we were looking at the different papers and research reports that we could access through the open databases, we did find that there were a number of mechanisms that countries were using to ensure that private sector and public sector do work together in different ways, engage with each other to deliver quality services. We did map those instruments across the 6 governance behaviors that Anna, my colleague from WHO, has mentioned and will continue to discuss further in the next part of the discussion. So it's important to say that we found that there is no standardization of these different instruments or mechanisms. We found a multitude of instruments and mechanisms. In fact, we have mapped over 280 mechanisms, which go from a macro levels of policy and macroeconomics to very concrete small instruments that do influence the ways on how services are delivered. So we have produced, you will have access to the slides. We have looked at the key issues, but however, I would say that I'd like to mention a few on the alignment. We do have information that alignment of the work plans and establishing intersectoral organizations that allow for this coordination combination does help. In terms of fostering relations, having these coordination mechanisms between public and private sectors, so committees, working groups, improving dialogue, it does help. On the building understanding, there is a clear indication that information exchange mechanisms are those kind of mechanisms that do facilitate the exchange of information in general, but also they do help and influence the understanding of who's doing what and then how things are going. So the improvement of record keeping, ensuring that programs are data driven are very important aspects of that part. Similarly, under enabling stakeholders, the capability in nurturing mechanisms, on nurturing trust, the accountability and regulatory mechanisms, and finally on delivery strategies, is a strategy on value sharing mechanisms. Next slide, please. As we were going forward with this, with our research, and I should say that we're still not completely done with it, we have identified a few issues that seem to underpin everything. There is a lack of standardization. There is a multitude of interventions that are being reported. Indicators and outcomes are not comparable across studies, even within private sector, across public and private sector. Therefore, that kind of lack of standardization, while it makes it interesting because you can see different ways of reporting, they do not allow for good comparison that can create the basis for a dialogue and understanding on how to move forward in this type of partnership. The second, which is on publication bias, of course, people want to publish good results, positive impact. Therefore, opportunities to learn from failures or things that have not resulted completely in what they intended are not out in the literature, which is a big lack of accessing data, but also it's a missed opportunity in understanding what is out there and what can be changed or improved. And then, as I already said, there is a lack of comparative studies. So there is no point to compare public and private. Right now, we don't have any of those studies available. Next slide, please. As we were looking at the literature, we looked also at the engagement with countries. So at this point, as we see that the research is still going on, it's still a very open field. The best way to learn it is by engaging and looking exactly at the processes, what is happening at the country level, and starting to co-develop the solutions. Some of them were mentioned by the panelists. Next slide, please. So for the countries that I mentioned, Nigeria, Ghana, but also Bangladesh, these countries have gone through a process in which they have collected and analyzed their information and data. So that data and information came from the key informant interviews, so people who are really working in the area, who have a stake in the process, who know what is happening, know the challenges, but also know the solutions. That was compensated with stakeholders assessment, country level, and either data collection. All the information was synthesized and fed it into what we call the multi-stakeholder policy dialogue. So next slide, please. Dr. Kennedy already mentioned that quite a few findings from Nigeria and Ghana also. So I would only go very quickly through a few findings, which may not be completely at the detail level that you may need today, but it still shed some light on what is happening. So meaningful engagement is not one of workshop or meeting or a policy dialogue. There is a need to consider an enabling environment for the private sector. There is a need to explore health systems issues and considerations. Regulatory and regulations is a very big aspect that everybody talks about. Finance is central and multifaceted. So it is central because a lot goes around funding, how incentives, etc. But at the same time, it's not only about incentives, it's also about gains. Next slide, please. Leadership and ownership of this type of processes needs to be reflected and given by the governments. It is important that in this process of engagement, there is an equal partnership in the process by both the public and the private sector. This kind of processes do need a skilled and neutral facilitation. We know we already heard today about the challenges of these discussions and dialogues. There is a need for enabling a meaningful dialogue and communication, which is basically the basis for building a relationship and of trust and exchange and support. Those kind of processes, but at the same time, the result, they need to be documented and shared, and that there is a clear need for cross-country learning. So within the countries, especially big countries like Nigeria or India, in which you do have a very high diversity in the implementation, but also across countries. So one country learning from each other, from the other, it is very clear that all countries are going through similar processes and nobody has all answers to these processes. Next slide, please. So what is next? The COVID was a big waking up call for everyone in terms of how we deliver health. So health is not monopoly of only one sector. Health is delivered by all actors in health. Therefore, looking at the private sector engagement and engaging with private providers in delivering health with those goals that everybody should have access and use good quality healthcare is very important. This is an important shift. It's something that is here to stay. and we all together have to find the best answers to the question. The country implementation has to be updated in terms of to reflect the new knowledge that is coming up, such as the WHO strategy, at least for us is very important, that can influence the governance behavior. So those leaves that do enter, that allow us to enter in the discussion, but also that create the and facilitate the implementation context. There is a definite need to enhance the partnership among partners and countries who are supporting the private sector engagement, in our case for maternal and child health. As I already said, there is not only one single answer. There are multiple answers to the processes, and we need to learn from these answers. We do not know all of them. We must learn so we can document, share, that everybody can benefit from this learning and sharing. And the last that I would like to share is that we need to build on the knowledge and evidence that exists, but also build this evidence-based. We need to invest on things that are what we call in general low-hanging fruits, start from points where there is a convergence and concern, like we are hearing a lot about information systems, financing incentives. So most likely we'll need to have a table of the key entry points that are of interest for everybody and try to unpack, but also to start to see how best to implement these mechanisms. To this end, and last slide from my side, at least at the global level, we're trying to work across partners and countries to see how best to align ourselves to strengthen the partnership, the learning and best practices, and the implementation support. So those are the basis and the strategic objectives of the just established maternal newborn child health private sector engagement working group. A lot of people who are today in the panel are members of this global working group, and it will be a good opportunity to see if others today are maybe interested to engage and contribute. This working group links to what Anna will talk later on, the country connector on UHC and private sector. So we are trying to streamline our work, our thinking and contribution to the global knowledge base for private sector engagement, but also to directly influence the policy making and implementation of this process at the country level. Over to you. I would like to, in fact, I would like to hand it over to my colleague Raja Chaba from JPIGO for the next session, so we can go through the last part of the program.
Thanks, Flirta. I think, and thanks to all the speakers and the panelists as well. I think such a rich discussion. So what's next for us? I think one of the key takeaways that we saw from today's discussion, that there are certain critical success factors if public-private partnerships have to succeed. I think one of the key points that came towards the beginning was educating the private sector investors on the need of healthcare, on understanding how this market works. That's such an important point, and it's a critical success factor for us to look at. Also, we spoke about how champions can actually play the role both within the public as well as the private sector to actually drive these collaborations forward. The third key lever is to actually be transparent and build the trust and set clear roles and expectations as part of the public-private partnership that we are creating. We also discussed a key lever around building the governance capacity within the public sector to actually support. And finally, looking at evidence generation. I think there's a lot of debate that we did today around the lack of data or the inability to share or what to share and how to share, the ambiguity around those principles. And that being a key lever also provides an opportunity for us to actually going forward. Can we create systems where data can be shared in a more comfortable environment? Can we adopt new business models which can help us look not only at service delivery, but also as a value for money opportunity going forward? Can technology and automation help us address some of these challenges? And finally, Frank spoke about innovative financing. I think that's a big area that can actually help us move forward and develop stronger systems and partnerships between public and private sector. So there are immense opportunities for us to see. And WHO has also formed few initiatives and efforts around this to enable such partnerships. And I'd like to hand it over to Anna to share a couple of those examples with us. Over to you.
Thank you very much, Rajat. Yes, and as Rajat and Blurt already introduced, one key platform that WHO recently launched is the Country Connector on Private Sector in Health. And this platform has the purpose to strengthen governance of the private sector for improved health outcomes through, as we mentioned today, lots of time, data, information systems, monitoring implementation, knowledge curation, and guidance and tools to help countries leverage the private sector to achieve universal health coverage. And the key audience of the country connectors, the first audience is the country itself. So people from the Ministry of Health, from governments, private sector actors. Recently, we engaged with COVID-19 task force members. And at the secondary audience, we also target to speak and align the work of funding agency, multilateral agency, implementing agency at the country, regional, global, and local level. So the functions of the country connectors has 6 activities, which aim at giving to countries the guidance that they need in engaging the private sector. As Radha mentioned before, what's needed is capacity building. She mentioned 3 capacities, and what the private sector, the country connector or private sector in health really wants to achieve is to build capacities at the country level. Next slide, please. And Blair already talked over the maternal, newborn, and child health working groups. The working groups within the country connectors are one of the 6 activities. The others are a clearinghouse of information on private sector engagement, a tool repository on all the tools that have been developed so far on engaging the private sector in health, an open WHO training course that I will speak on in about 1 minute, sorry, and the super desk to help countries raise their questions. Either public and private actors raise their question on how to engage with the governments or with the private sector in delivering universal health coverage. And as Berta was talking before, one other key activities is the one of the working groups, and we have 3 working groups set up so far, one on data, one on COVID-19, and one on maternal, newborn, and child health that Berta spoke about just a few seconds ago. Next slide, thanks. So finally, I would like to present you one pivotal product of the country connector, which is the Open WHO training course. Can we? Yes, okay, there are some animations. And the training course has been launched 1 month ago on the Open WHO platform, which is a free platform where everyone can access and join the course. And the learning objectives are really to talk at the country level to all stakeholders engaged in delivering services, healthcare services, and build capacities, provide them with the tools on how health system governance can be inclusive and can look at both the public and the private sector and engage all health actors to achieve universal health coverage. So thank you very much. I think we are coming to the end of our webinar, and I would like to hand over to Sarah. Thanks.
Great. Thank you so much, Anna. Awesome. Well, yes, thank you all so much for attending our session today. I think we had a really rich conversation, both in the discussion with the panelists as well as in the chat, and just really appreciate everyone taking the time to join us for this session. I also want to extend a huge thank you to all of our panelists and speakers who made today's event possible. All of the organizations are listed on the screen in front of you, but just thank you so much to everybody for putting in the time and energy to making this such a successful conversation. I do also want to invite all of our participants who joined us today to continue discussions with people who you connected with in this conversation. There's the Brello networking app that we have through the SoundCult forum, and are also happy to continue chatting and connecting offline as well. So just thank you all so much. If all of our panelists and speakers want to come on video just to say goodbye to everybody, we can conclude today's session. And yes, a big thank you to everyone for making this such a successful conversation.
Thank you. Bye.
Thanks a lot. Bye.
Thanks, everybody.